We are about to go into a very short panel. And what is this panel about? It's about looking at the lived experiences. Beyond the data, we have the names and the faces, and a couple of the speakers here say that there's the names and faces and families behind the data. Now, I am going to invite two powerful, wonderful African women on stage to join me. Nafisa Jidawi, midwife and founder of Wajamama in Zanzibar. A round of applause as they come on stage. And Koiwah Koi-Larbi from Action on Preeclampsia, Ghana. Thank you, Koiwah, for coming today. Now, and as Koiwah and Nafisa take the stage, just a trigger warning that the conversations we're going to have in this panel, and probably because of the nature of our conference, in most of the sessions, or a good number of the sessions, may be triggering. We're going to talk about loss, about child loss. We are going to talk about caregiving after loss. So please, take care of yourself. If you feel triggered, if you feel you need some space, some time to just, go and take a breather, there is a room available, room number 34. Room number 34 is available. It's not a meeting room. It's not for you to go and hold your meetings there. But if you feel you just need some space to breathe in because of the conversations that we may hear or take part in, please go ahead and do that. Now, Koiwah, Nafisa, good to see you. We have been talking online, so really wonderful to finally put the names and the faces to all the calls and all that. Thank you so much for being here. Right? I will start with you, Koiwah.
Yeah.
Is your mic on? Let's check. Yes. So I'll start with you, Koiwah. When we were speaking, you said you brought something with you. Oh, yeah. And you wanted us to see what that thing is.
Yes.
And I think let's start there. There should be a slide coming up now. Mm-hmm. I want you to talk to us about what we are seeing here. Yeah? There we go. What is this? Why did you insist on us having this?
Okay. Thank you for having me here. My name is Koiwah. You can call me Mama K. I am a 4-time survivor of hypertensive disorders of pregnancy. Out of 4 pregnancies, I've lost 3 babies, and I have 1 surviving child. I have had all the spectrum of HCP, name it: eclampsia, severe preeclampsia, gestational hypertension, and HELLP syndrome. My first experience was with my first pregnancy sometime 2012 with my former partner. Like every woman in Africa, when you get married, you're expected to have a baby. So I did get pregnant, and along the journey, I began to have symptoms. I patronized private quality care, and all these symptoms included headache, bloating, among many others. But mind you, in my context, when you're bloating, a baby boy is on the way. But not knowing I was sick. So somewhere along 27, 28 weeks, one of those days, when I was complaining of headache, and I told my former partner, and he was like, you should go and rest, just like how the midwife or the nurse said. I did rest that day. But at 2 a.m. the following day, I went into a fit. So what I'm sharing is what I was told. I was rushed to the hospital. 2 private clinics rejected to have me, so I was rushed to a public hospital. When they got there, my former partner was barefooted, and the emergency doctor there told him, your wife is suffering from eclampsia. We need to have an emergency cesarean. At this moment, mind you, I was gone. I was unconscious. So I woke up the following day with so much pain. I saw many people around me when I woke up, but I couldn't be bothered. All I asked was, where's my baby? I was told that my baby was in NICU, but of course, because I was in pain, I couldn't see him. But somewhere along the 3rd day, I went there, and he was so tiny. We called him Baby Fifi. I couldn't bathe him. At a point, 5th day, they said they were about to start with breast milk, through the nasal thing. And they did start, but then there were complications. So I was discharged, And the following day when I was coming to check on him, I was told that baby Fifi had passed. You can imagine my trauma as a first-time pregnant woman, starting this journey with many women who have had years, but only me to go home with an empty hands. It did traumatize me in many ways. The tears, withdrawal, denial, accusations, name them. But luckily, 6 months later, I got pregnant again. This time, I liaised with my former partner and said, let's mobilize resources so that I can go to the US to deliver, because I had school there before. I did go there. But somehow, severe preeclampsia did not set in till 30 weeks. And they managed me from 30 to 37 weeks. During my period there, I went to emergency twice. But at 37 weeks, I was delivered of my baby girl, baby Dioli. She's 12 years now and probably sleeping in Ghana right now as I speak. And so, at this point, I thought I had defeated preeclampsia. I was excited. I'm like, yeah, more babies, because the goal was 5 anyway. And so, 2017, I got pregnant again. This time, I had no symptoms. Not the headache, not the bloating, not all that you think of. But then I was always tired. And so then I went to the hospital with my former partner, and they were like, you need to be admitted. I'm like, no, doctor, please don't admit me. They insisted before I was admitted. And when they did, for 4 days, they were checking the fetal heartbeat. On the 5th day, they checked, and they couldn't hear the heartbeat. We had to wait for the doctor, because mind you, this was a private hospital, so you don't have a 24-hour doctor there. And we waited for the doctor, and he came, he's like, Koiwah, we lost the baby. At this point, I couldn't cry. All I asked the doctor was, how fast can we get this dead fetus out of my womb? He did say he could induce me and it would come through, my vagina, but that failed. So once again, I went into the cold theater room and came out with so much pain, but with no baby to compensate my loss. It was at this point during my 6 weeks postpartum in my bed that I was searching online, looking for somebody to talk to, wondering what was going on. I found academic publications, but that was not what I was looking for. I was looking to find answers. Am I cursed? What's wrong with me? Am I really a woman? I did find some organization in Australia, Action on Preeclampsia Ghana, and then they helped me through some conversations. So after that, I told them I wanted to do something similar, and that's how come I founded an NGO, APEC Ghana, in 2017. Mind you, at this point, I was working with a lot of researchers and doctors.
Yeah.
I have no background in science. But because I was so confident, I was not ignorant, I decided to get pregnant again. Because as I said, the goal was 5.
Yeah.
I did get pregnant, and this time there was so much hope. So much hope. Because it was in ignorance, I knew what the symptoms was, name it. But somewhere around 27, 28 weeks, my doctor says, my platelet level is going down, and I'm having HELLP syndrome. They need to deliver. Baby Grace, if you go to the previous slide, Baby Grace came out weighing less than 1 kg. I didn't get the chance to go and look at Baby Grace, but my mother did visit her at the NICU. And every time she went, the doctor there was asking her questions about our economic status. And after some time, the doctor then told her, oh, there is this medicine called surfactant. If you could get it, it could increase the chances of Baby Grace surviving. We were told this on a Saturday. We combed everywhere in Accra, that medicine. It was not in stock at the hospital, and it was nowhere to be found. And when we found it, and they brought it, and I was ready to go see Baby Grace had passed. So I still say, if I Koiwah Koi-Larbi, I'm the worst case scenario of what hypertensive disorders or pregnancy can present, then Ghana has not given me my baby. To that effect, Africa has not given my baby. I'm a mother today because I patronize quality healthcare in the United States. That should not be my story or the story of any other woman. Thank you.
Thank you. Thank you, Koiwah. And please, if we can just go back to that last slide, because there's something there that really gets my eye. The previous slide, where Koiwah, you say, I am on a quest to find out what I did wrong. Nafisa, when you hear that, a mother asking what she did wrong, what does that say about the system around her? What does that mean for you as a midwife?
Yeah. So first of all, I was not prepared for that. Thank you so much, Koiwah, for sharing your story. And I'm so sorry that you suffered such tragic losses. What I really love is that you took that pain and that trauma and you turned it into something actionable and positive so that no other mom has to face the injustice that you faced. Thank you for all the work that you're doing, sis. Okay, so for me, Mercy, when I hear that, when mothers are asking, what did I do wrong? It tells me that at the healthcare system level, us healthcare providers, we did not build a partnership with that woman. Our job as healthcare providers is to walk with the women together throughout their pregnancy. In fact, even before pregnancy, during labor, during birth, and the postnatal period. It's important for us to give them information. So it tells me that we did not have a platform that gave the woman sufficient information so that she knows how to advocate for herself and also understands that she didn't do anything wrong, that this is a very common thing that happens. And so, yeah, like I think building those partnerships with women is really, really important. And it also tells me that, of course, as healthcare providers, we want to do that. You know, we don't go into this profession to cause harm or to not give information, but unfortunately our systems worldwide, and this is not just a sub-Saharan African issue. You see it in the US, you know, where like chronic understaffing and also systemic racism really impacts women and their families on a daily basis. You see it in sub-Saharan Africa. So, you know, I worked there, I worked here in Zanzibar, where in addition to chronic understaffing, we're also seeing undertrained, under-resourced, underpaid, and clinicians who are way stretched beyond their limits. So it's like, even if they want to, how do we create those spaces to allow them to give this essential information to women?
Thank you very much, Nafisa. And back to you, Koiwah. Still on that line, because I think that's the strongest line for me when I look at that slide, because it has so many questions. Do you still feel that it was about you? At what point did you begin realizing that, and I don't know if you've realized this yet, that this wasn't or isn't entirely about you? Do you have that feeling that it's not me, it's not my fault? Where are you at right now?
I think right now, I feel it's not my fault. But back then, with the first experience, that was not the feeling. Because I was completely ignorant to what the condition was. I did patronize private healthcare. It wasn't the case that I started antenatal late. Mind you, even with my first experience, when they were rushing me to the hospital and they called my mom, and they were like, Mommy, Koiwah, this is what is happening. She was like, oh, that's my disease. But she had never mentioned it to me.
Is this your mother?
That's my mom. And she had never mentioned it because she probably didn't know it was a risk factor for any of her daughters to suffer. So you can imagine the trauma that we went through with that. So back then, I did think it was all my fault. Now, I don't think it's my fault. I think that it's a shared responsibility. I, the patient, you, the healthcare provider, you, the researcher, you, the policymaker. And so it is all of us, our responsibility. And so if we then all fail, then it is all of us, our fault.
Nafisa, how close do you see this every day in your work at Wajamama? How often do you see this?
I see it so often that we've fully normalized it at this point. It's a very common thing. In fact, like as we're sitting here, like, I don't know, like so many women are suffering from the same injustices. It's a very common thing. And because I feel like some of our healthcare systems, it's almost like we've given up. And it's like, this is just what happens. And we just roll with it. And there are solutions, and we know what those solutions are. So yes, it's very common.
I know there are people seated in this room probably that would resonate with what you're saying. When your mom said, oh, that is or was my disease, we tend to own some experiences, however negative, however traumatic they are. What is one thing you would tell the delegates sitting here today, whether they are parents, whether, it's healthcare providers, they have probably gone through this as parents or at some point suffered child loss? What is one thing that you would want them to know as they head into the week? Koiwah.
Thank you very much. Your question reminds me of a quote from Tenon in 1788, where he says that no one is more worthy of care than the pregnant woman who carries within her the support of empires and the germ of future generations. As we are going through these conferences and after, when we go back to our nations, let us be guided by what the theme we have here, moving forward. And I dare to add that we must move forward with urgency. I dare to add that we must move forward to change the narrative. Because, Mercy, the narrative must change. It must change for me. It must change for that woman who's probably listening to us. It must change for every family or any woman who is aspiring to become a mother, where a beautiful thing becomes a painful thing. Because indeed, no woman should die given life, and every child deserves a chance to thrive at life. Thank you.
Wow. Every child deserves a chance to thrive at life. Nafisa, if one thing needs to shift in this room, how many do you have? All right. If two things need to shift in this room, in this conference, that could actually make your work a little bit easier, starting next week when you go back to Zanzibar, what would that be?
Ooh, Mercy, that's a tough question. Okay. I think in terms of, we have to prioritize, I guess. So I would, if things were to shift, I would really ask partners here and those working here and so on to really invest in pre-service education, because that's where the problem begins. A lot of times our healthcare providers graduate into the system not properly trained to provide high quality healthcare services, and that's where the problem begins. So I would say that, and a part of that, I would ask for heavy investment in simulation-based learning so that healthcare students can learn in controlled simulation settings and refine their skills there before they go and care for humans. And then at the same time, that simulation-based learning needs to be very continuous and very frequent in healthcare settings so that healthcare providers can always identify what the gaps are within their teams. They can review evidence-based practices, and so that they're able to address those gaps before an emergency happens. That was one.
Mm-hmm. Go ahead. That was two.
My number two, I would say definitely investing in communication strategies. And I will second what Koiwah was saying regarding changing narratives. So changing narratives for me as a healthcare provider. So let's face it, globally, we have lost trust. Healthcare systems, healthcare providers, we have lost trust. Okay? So here we are, we're talking about how we're going to change things, and we will go back and change things. But the community has already lost their trust in us. So how do we get that trust back? And we get that trust back by having proper communication strategies to change the narratives about our healthcare systems, nurse midwives, other healthcare providers as well, so that people want to come into our facilities. And when they do come in, we cannot fail them again, because they're never coming back, and not for their antenatal checkups, not for their births, and they will tell others not to come as well. Mm-hmm. So communication strategies, but also making sure that when people do come in through our doors, we have spaces and also care delivery that is humanizing, that is very people-centered, mm-hmm. And they're not going to come in and get disempowered because they walked in through our doors. Mm-hmm. So that's
right. Thank you. I know. I feel like, yes. I feel like Nafisa wants to add something because I've heard her speak in other conversations and it's always a battle trying to let Nafisa, that's where we end. Now, this is a conversation that we could have for more than an hour, all day long. But that is the essence why we're here today. And I'll give you, Koiwah, the last words. Because Nafisa talked about trust, and I really want to, this is very random, I hadn't thought of it, but you left Africa to go and deliver elsewhere. Nafisa says the problem is not about, or just in Africa, it's everywhere. Where is your trust now? Do you have any?
Interesting.
Asking this as a Pan-Africanist.
My mom used to tell me I shouldn't trust anybody except myself. But I went to the United States because I trusted the healthcare system there. Interestingly, when I came back and I was talking about my experience, I had a few doctors who backlashed me and told me, but why are you complaining? Preeclampsia is an old disease. You're lucky you went there and you survived. Many also died there, so why are you complaining? So, yes, there's some distrust, but there's also some trust, because I think over the last years, there's been some improvements in my healthcare system. Not substantial, but we are getting there. And so I think that we need to continue to work together as partners. Patients working together with the caregivers, working together with the researchers, working together with the policymakers. It is a collaborative effort. It is a togetherness effort. And it's only with that some of us and the group and the patient that I represent can really trust the healthcare system. Otherwise, they may lean on other social supports like their religious leaders, getting medical advice from their pastors who are not trained, and therefore coming back to the facility very late, and then you're coming to blame them? No, because they don't trust you. So let's take that.
Thank you very much, and I think that's a beautiful place to end it, about trust. Thank you very much, Koiwah and Nafisa. And, as we continue this week, good people, I hope we really remember these voices and really remember that, like every speaker who's come up here this afternoon, almost each one of them has said that behind the data, behind the numbers that we will be throwing around, it's Koiwah. There are names, there are faces, there are children babies that didn't survive, didn't thrive. There are others that have survived, but they are not thriving. There are mothers who've given birth, they are on survival mode. They are not thriving. And that is why we're here today, good people. Let's not forget that. Wherever you go this week, and even after Friday, the commitments we make here, it's for Koiwah and the millions of mothers and the millions of babies that she represents here today. The 3 she lost, and who she is as a person. Let's not forget that. Thank you very much, Koiwah. And thank you very much, Nafisa, for a wonderful, wonderful panel. Thank you very much. A group hug? Thank you so much. Thank you. Thank you so much. Ladies and gentlemen, that is the final panel of the opening plenary. So thank you so much